Hi there everybody, my name is Dr. Shaz Rehan and I am an ophthalmology registrar. In this short video I just want to share my personal experiences and knowledge with respect to how I learned anatomy during medical school. Anatomy can be a very daunting subject to embark upon and try to memorize and learn. However, I will share my best resources with yourself that allowed me to excel within this particular discipline. Anatomy is great fun to learn, and if you have the right resources, the learning experience can indeed be very satisfying. So please stay tuned to learn more about what I used to excel during my anatomy module in medical school. In addition to attending your anatomy practicals, which may be a combination of workshops or pro sections, for me I was fortuitous that I had anatomy over the entire first semester, and it involved actually dissecting a body, which allowed us to learn intimate details at a very controlled pace. I am now going to share with you the 5 particular textbooks that I used to learn anatomy. In terms of anatomy, this covered both the upper limb, lower limb and everything in between, and the head and neck, which we covered during the second year of medical school. So I found this particular book very useful and fantastic. Essentially, this book has brilliant pro sections within it, and you can see the highlighted areas from when I was actually learning this particular book, and I found the pro sections to be beautifully depicted in pictorial format, and the labels were very easy to follow. And I found this particularly useful during revision periods, whereby I could cover up the answers and essentially look at individual labels and try and then decipher and interpret what the arrows were pointing at. So this book I would highly recommend, and I found it probably to be the best pro section book available. So compared to the previous book, which largely involved pictures and labels, this book also involves and incorporates both pictures of pro sections and then a diagrammatic format of the pro section, as you can see here, but it also has associated text, which I found to be very useful. So again, I would highly recommend this book. And leading on from that, I would also recommend this book, which is again another pro section book, and similar to the first book that I showed and recommended, it has nice depictions of pro sections with then labels and answers, which are quite beautifully laid out. And again, it summarizes things in terms of the main systems, ranging from head and neck, upper limb, lower limb, abdomen, pelvis and thorax. So this is also a very useful book. A lot of these books now also, especially the newer editions, have associated CDs which you can also use. So for example, this version, which is the 6th editions of Macmillan's, also has a CD which you can use for extra pictures, and it also has a particular quiz for different sections that you can use to test your knowledge. I think for myself and for several other medical students in my year, the go-to book for anatomy was this, Essential Clinical Anatomy. I definitely covered this book from cover to cover, and I pretty much memorized all of the text within this book. and I felt that the information was very succinctly presented. It had a lot of clinical information associated with the anatomical descriptions, which made things very clinically relevant and therefore allowed me to memorize and understand things far easier. So for example, if you look at this section of chapter 2, which is related to the abdomen, after describing the abdominal viscera, it goes on to describe what peritonitis and ascites are. And after reading, for example, what peritonitis and ascites are, the anatomy that you will have hopefully read prior to reading this particular section will make a lot more sense. And when it makes a lot more sense and you understand it, you will find it far easier to remember. It also has nice pictures. The pictures are very succinct and are very focused on the particular parts that the text is describing. But what I used this for primarily was the text and the clinical information and clinical relevance of the anatomy being described. And then in order to supplement that, I used the book that every medical student has, Gray's Anatomy, and I used this in order to supplement the text that I had already covered in Essential Clinical Anatomy. And I found the pictures within this book to be absolutely beautiful and fantastic. So I used the pictures from this book and added them to the notes that I made from Essential Clinical Anatomy. What Gray's Anatomy also has is, for the chapters described, it also has clinical cases, which again puts things into clinical context, which makes them easier to understand and therefore easier to remember. The final resource which I found very useful was using online anatomy videos on YouTube. This was both a combination of prosections and also animations in order to allow me to visualize certain parts of different bodily systems. One particular YouTube channel that I found useful, I have linked down below, and it can be seen on screen here. And I found these videos to be absolutely fantastic in helping me to visualize in 3D format sometimes quite complex anatomy that I was trying to learn. In summary then, my advice to medical students who are trying to learn anatomy is: learn Essential Clinical Anatomy cover to cover, focus on and know all of the text and clinically relevant anatomy, because usually that's what you will be assessed on, and that's what you need to know moving forward during medical school and in terms of your professional careers and lives. Supplement the text with what is written in Gray's Anatomy and the cases that are described in Gray's Anatomy. And I definitely found the pictures in Gray's Anatomy, the cartoon pictures, to be fantastic. Once you have done that, you can then move on to looking at pictures of prosections, because cartoon depictions of anatomy are very well drawn and are very illustrative. However, they do not always accurately depict what an actual prosection or what real life anatomy looks like. So therefore, put the two side by side. So for example, get a prosection picture of the mediastinum and get a cartoon illustration of the mediastinum and compare and learn the two, because in examinations at medical school you may very well get asked to label a cartoon and or a real life specimen. The more books you read, the more pictures that you look at, and the greater resources that you cover, will all help you to reinforce and reinstate the knowledge that you are trying to learn and practice. With anatomy, as with many other things in medical school, repetition is king and key. The final thing you can, or the final things that you can then do in order to cement the knowledge that you will have hopefully learnt, is practice, practice, practice in terms of quizzes and testing yourself with your fellow students. And please do tap into the free resources that are available online, particularly on YouTube, such as the channel I mentioned earlier, and watch these 3D videos to help you to see things from down below, from above, and lateral views, etc., because again they will really help you to cement knowledge and understand quite tricky associations and relative positions between different parts of anatomy. Finally, remember, anatomy is great fun and it will serve you well moving forward, because concepts surrounding physiology may change, but anatomy is anatomy and it doesn't really change. So therefore, once you know it, you know it. If you have found this video useful and you are a medical student or you are a doctor and you feel that you would benefit from other tips and or advice and guidance that I may be able to provide you with, then please do comment below and let me know what future videos you would like to see, and I will do my best to try and produce those videos in order to help yourselves. Thank you so much for watching, and enjoy anatomy and enjoy medical school.